from the bone, how the vitamin D has traveled to other areas. You have seen the, I think, 5 decades.
Yes.
You are the expert in vitamin D, I think. You have got
So
awards for vitamin D research also, right? So if you can tell that how the vitamin D research has changed from bone, and what are the different drastic changes you have seen in the vitamin D research in the last decades?
So at the cellular level, it's been known for quite some time that vitamin D, the 125 analog, 125 form of vitamin D, 125 dihydroxy vitamin D, plays a very important role in many in many body processes, including cell differentiation, proliferation, all those things. So starting with infections to immunity to metabolic disorders to cancer, everywhere in the cycle of the pathophysiology of that disease, vitamin D has a role. So a lower vitamin D broadly aggravates disease in all these situations. Now, the issue there is whether, so let's first understand the role where is well established. The second role after the bone that is well established is the role in prevention of respiratory infections or immunity. Not, we don't know in treatment and all, but overall it seems that people who have lower D levels are more likely to get respiratory viral infections. At least there is one meta-analysis that suggests that in most people. And very interestingly, again in your questionnaire, all the hype about vitamin D in the recent few months has been about immunity. And more people knew about immunity and vitamin D than
Yeah.
menopause and osteoporosis. That is amazing. So, so to me, that shows how much messaging is important.
Yeah. I think
So
there are news also. If you see, there are a couple of news on the Times of this.
yeah. So we've ourselves spoken about it through various channels and all. But the truth is that now people are receptive. They're receptive to corona. They're receptive to COVID. Naturally, everyone. So if you say that maybe if you are more deficient in vitamin D, maybe your chances of getting corona or severe corona or COVID are higher, then people will listen. My God, I don't want that. So if you tell them your chances of getting a fracture 20 years from now will be higher, they'll say, we'll see. It's long term, who has seen. So therefore, that is human psychology. So vitamin D does seem to play a role in immunity in the sense that not that you pump yourself with vitamin D, but people who are low in vitamin D or deficient in vitamin D have a greater risk of getting respiratory infections. Therefore, this all this talk about vitamin D during corona times.
Yeah.
But vitamin D also has a role in cancers. It has a role in diabetes. Now, why? What is the connection between diabetes, vitamin D, bone? So let's look at the diabetes and bone connection first. Of course, the first thing is that people with type 1 diabetes, let's forget that for a moment, but type 1 diabetes actually have a 6-7 fold greater risk of osteoporotic fracture than than normals.
Yeah.
6-7 times. And even people with type 2 diabetes have roughly double the risk of fracture.
Yeah.
Some people say 1.5 times, some people say 1 point, but in that zone, 50 to 100% more. So therefore, if there are two 60-year-olds, one is a poorly controlled diabetic for last 15 years, the other one is otherwise healthy, then the person with diabetes has a greater risk of fracture. And the person with diabetes who has diabetes for a long time, who has other complications of diabetes, who has risk of falling because of eye and neuropathic complications, all those factors, they combine to increase the risk of a person with diabetes for getting osteoporotic fracture. So diabetes is now considered one of the major risk factors for osteoporosis. Having said that, and realizing that even diabetes tends to occur a little older age group, in the little older age group, so typically patients that you see are above 50 and many of them are above 60. And that is the time osteoporosis per se also hits.
Yeah.
So, and if you have diabetes and osteoporosis, you realize that, that diabetes can really aggravate that. So therefore, when we talk of diabetes and osteoporosis, we have to control diabetes well, and that too with agents that are not harmful for the bone. At the same time, we have to ensure proper bone health for diabetics. Now, ensuring proper bone health means regular exercise, proper calcium intake, and proper vitamin D.
Yeah.
Now, therefore, it makes sense for your older diabetics at least, again, like any other older person, but even more for older diabetics, maybe at 50, you need to make sure that they get enough vitamin D and calcium. Now, if you're deficient in vitamin D, you're exposing yourself more. You already have diabetes, you're getting older, and then you're allowing your vitamin D to drop. So therefore, that is the link. There is other pathophysiological links also. There are studies that have tried to suggest that vitamin D can actually influence glucose tolerance. There are some studies that have suggested that vitamin D can reduce conversion from pre-diabetes to diabetes. There are studies like from Calcutta itself. Deep Datta did a study which showed that. But what I'm trying to say is that that is still, it's not 100% sort of clear. But the bone health and diabetes is important. That is very clear. And to maintain bone health, you need good vitamin D. That is very clear. So I think that's how we should look at it at the moment.